If you're preparing for the MSRA SJT, have a look at this example SJT question. Okay, time's up. I've launched a poll for this one because for section 2, you don't rank anything. You're not ranking 1, 2, and 3. You just tick the ones that you want. So if I show you how it is in the actual exam. So in the actual exam for section 2 questions, there'll always be 8 options, and you just tick the ones you want. Okay, so that's it. It's like that. That's how it is in the exam, right? So if I stop that, so I can see that the popular options are B, D, E, G, and H, with very few people picking F, C, or A. The others, there's quite a few. Okay, so let's do a quick read through. So you're treating this patient who's diabetic. He's unwell enough that after having the fall at home, he had to be admitted and kept in hospital. You can see a lot of people have a fall. They might be seen in A&E, rule out a fracture, sent home, right? But you see, if they've been admitted to the care of the elderly ward after this fall, they must be unwell enough that it was felt that they needed to stay in hospital. They were admitted. And you notice there's a spike that's unexplained of their sugars every evening. You can see each evening, not one off, before dinner's served. And he's talked about his sweet tooth, and you've seen that his wife, who comes in the afternoon to visit, she brings him some sweets. Okay, so that's the scenario. The preferred response is B, G, and H. Okay, B, G, and H. Now, loads of you had H, quite a few of you had G, not that many had B. Okay, a lot of you either had D or E as your third option. Now, the way these are marked, very straightforward. 4 marks for each one that you get right. So if you get all 3 right, you get 12. You get any 2 right, you get 8. Any 1 right, you get 4. There's no negative marking. Okay. And remember, it's the most appropriate combined response. So you've got to ask yourself, does it make sense when I read them back together? Okay. Because if it doesn't, then you probably know that you haven't got full marks. So one of the things about section 2, remember, section 1 is not about good and bad, it's better or worse. Section 2, there are some options that there's something negative about it. Shows a clear negative for one of those domains, empathy and sensitivity, professional integrity, coping with pressure, or it clearly goes against some GMC guidance. So you could eliminate that, and that makes your decision easier. You're picking 3 from maybe 6 because a couple of them, there's something clearly wrong with it. So there's something clearly wrong with some of the options here. Let's look at the ones we can eliminate. What's wrong with A? Why can A not be part of the right answer? What's clearly negative about it? The word confront. It shows a clear negative for empathy and sensitivity. Okay. How do you think the patient would feel? He's unwell enough that he needs to be in hospital right at the moment. by definition, that makes him quite vulnerable. And you're confronting him about someone else's behavior. He might have no control over his wife and her behavior. And so this is a very inappropriate way to approach the situation. It shows a clear negative for one of the domains. And so it's clearly out. So A's out. Okay. What's wrong with C? Well, think about one of the things in good medical practice is good clinical care. You want to put the patient's best interests at heart. If there's an unexplained spike each evening, that suggests it's regular. You can say each evening. Every word's important in the SJT. If you measure it less frequently, it might get worse and it might take you longer to pick it up. So this potentially puts the patient at risk. Okay. I'll come back to D&E because loads of you picked D&E. What's the issue with F? Why is F not part of the right answer? Hardly anyone picked F anyway. So one of the subdomains is about knowing your role in the team. And it's just not your job to decide who can visit how often. Whose job is that? The ward manager decides that. Sometimes, if it was having an impact on clinical care, the consultant might make a decision about that, but that's not recognizing your limits. As an F2, and remember, in every one of these scenarios in the exam, it doesn't matter what level you are now, you have to imagine you're an F2, all right? It's just way beyond the responsibility of an F2 to make a decision like this. But beyond that, think about the patient's psychological well-being. They might really value seeing a family member, a loved one, every day when they're unwell in hospital. You to say, oh, only come in twice a week, you might be thinking about that for clinical care, but how might that impact their psychological well-being? Do you see? That's why F's out. Now, D&E. What's the issue with D&E? It's the same issue that's with D, that's an issue with E. In both D and E, there are inappropriate breaches in confidentiality. And this is where knowing the GMC guidance, so you know when you can and can't breach confidentiality, when it might be appropriate, in which situations can you share information without consent, would help. Do you see, if his wife is already visiting and you discuss the recent results, there's no option here where you've combined it with where you've got his consent to share those results. That's a breach in confidentiality. Just because it's his wife doesn't give an automatic right to know his blood results. Similarly, if you discuss the results with his wife, there's no option here where you've asked his permission. That takes away from his right to say, no, I don't want my wife to know. Someone has capacity, they have the right to make that decision, right? Okay. And so this one, actually, these three are the only three that are left. Now, how do you know you've got it right? Read them back together. It doesn't have to be in alphabetical order, but ask yourself, if I add in the word and, does it make sense? And number two, together, do they address the scenario? So this is the scenario. Does this make sense? Try and picture it. It really helps. Okay. I'll do this one first. Discuss the recent blood sugar levels with Mr. Jackson and explores that. So, look, Mr. Jackson, I've been noticing this trend that each evening your sugars are really high. I'm not really quite sure why. But what might be helpful is for us to find out a bit more about your diet. Just talk me through yesterday. What do you have for breakfast? What about lunch? What about dinner? Did you have any snacks? Okay. And, well, look, if you have been having some things that are sweet and you've got a sweet tooth and, your sugars aren't controlled at the moment, suggest some sugar. Here's some treats that you could have that might give you the taste, but they've actually not got sugar, so they shouldn't impact your sugars in the same way. And continue to monitor their blood sugar levels at least daily. Because you must, if it's each evening, you must at the moment be doing it at least daily. So at least as frequently as you've been doing, continue to monitor. Does that make sense together? Yes. Does it resolve the situation and show positives for those domains? Yes. That's how you know you've got it right. In section 2, you can know you've got full marks before you move to the next question by doing that simple test. Read it back together. Does it make sense? Does it address the situation? Okay. So B, G, and H. Now, if you found that helpful, there's more examples in our MSRA Masterclass webinar recording. You can access it for free. It's over 75 minutes. It's on our YouTube channel. I'll pop the link down below.